Question 1. A nurse is preparing to administer IV potassium chloride to a patient with hypokalemia. Which action requires immediate correction? A. Diluting the medication in 100 milliliters of normal saline. B. Using an infusion pump for administration. C. Administering the drug via IV push. D. Monitoring cardiac rhythm during infusion. Answer: C. Administering the drug via IV push. Rationale: IV potassium chloride must never be given IV push due to the risk of fatal cardiac arrhythmias. It should be diluted and infused slowly using a pump, with continuous ECG monitoring. Question 2. A nurse is verifying a new prescription for a pediatric patient weighing 20 kilograms. The medication order reads, amoxicillin 500 milligrams, PO every 8 hours. What is the priority action? A. Administer as prescribed. B. Clarify the dose with the provider. C. Check for allergies. D. Document the weight in the chart. Answer: B. Clarify the dose with the provider. Rationale: the standard pediatric dose of amoxicillin is weight-based, 20 to 40 mg/kg/day. 500 milligrams TID exceeds safe limits for a 20 kilograms child. The nurse must clarify the dose before administering. Question 3. A nurse receives a new medication order for a patient with a known history of anaphylaxis to penicillin. The prescribed drug is piperacillin-tazobactam. What should the nurse do first? A. Administer the medication with epinephrine on hand. B. Ask the patient to sign a consent form. C. Notify the provider about the allergy. D. Monitor the patient closely after administration. Answer: C. Notify the provider about the allergy. Rationale: piperacillin is a penicillin derivative. Administering it could cause a life-threatening allergic reaction. The nurse must advocate for the patient and contact the provider before giving the drug. Question 4. A nurse is administering morphine IV for post-op pain. 10 minutes later, the patient is drowsy and has a respiratory rate of 8 per minute. What is the nurse's priority intervention? A. Apply oxygen via nasal cannula. B. Call a rapid response. C. Prepare to administer naloxone. D. Elevate the head of the bed. Answer: C. Prepare to administer naloxone. Rationale: the patient is experiencing opioid-induced respiratory depression. Naloxone, an opioid antagonist, must be administered immediately to reverse the effects and restore adequate breathing. Question 5. During a medication reconciliation at discharge, the nurse notices the patient has 2 prescriptions for warfarin from different providers. What is the nurse's next step? A. Instruct the patient to choose one prescription. B. Notify the pharmacy to cancel one order. C. Clarify with the prescribing providers. D. Ask the patient which one they have been using. Answer: C. Clarify with the prescribing providers. Rationale: duplicate anticoagulant prescriptions pose a serious bleeding risk. The nurse must coordinate with providers to clarify and prevent harm through duplicate dosing. Question 6. A nurse is precepting a new graduate who is about to administer insulin glargine and regular insulin in the same syringe. What should the nurse do? A. Allow administration as long as blood glucose is high. B. Stop the nurse and explain the error. C. Let the nurse continue and document the incident later. D. Observe the patient for any side effects. Answer: B. Stop the nurse and explain the error. Rationale: insulin glargine must never be mixed with other insulins. The preceptor has a duty to intervene immediately and prevent a potentially dangerous error. Question 7. A nurse prepares to administer metoprolol to a patient with a BP of 90 over 60 millimeters of mercury and HR of 56 BPM. What is the most appropriate action? A. Administer and monitor post-dose vitals. B. Withhold the drug and notify the provider. C. Give the drug with extra 4 fluids. D. Document and continue other medications. Answer: B. Withhold the drug and notify the provider. Rationale: beta blockers like metoprolol lower BP and HR. With pre-existing hypotension and bradycardia, administration can be dangerous. The nurse must withhold and consult the provider. Question 8. A patient receiving IV vancomycin suddenly develops flushing and hypotension. What is the nurse's first action? A. Stop the infusion and assess the patient. B. Administer diphenhydramine. C. Notify the provider and document. D. Increase the IV rate to flush the reaction. Answer: A. Stop the infusion and assess the patient. Rationale: these symptoms suggest red man syndrome, a reaction to rapid vancomycin infusion. The nurse should stop the infusion immediately, assess the patient, and notify the provider. Question 9. A nurse is reviewing labs before administering furosemide. Which finding requires immediate action? A. Potassium 3.1 milliequivalent per liter. B. Sodium 138 milliequivalent per liter. C. Creatinine 0.9 milligram per deciliter. D. BUN 15 milligram per deciliter. Answer: A. Potassium 3.1 milliequivalent per liter. Rationale: furosemide causes potassium loss. Administering it with a low baseline potassium ion increases risk of cardiac arrhythmias. The nurse must correct the electrolyte imbalance first. Question 10. A nurse is preparing to administer IV antibiotics to a patient with sepsis. The patient has no allergy bracelet but says, "I think I'm allergic to something they gave me last year." What is the best action? A. Continue and monitor for reactions. B. Call pharmacy to verify the allergy. C. Ask family if they know the allergy. D. Hold the medication and clarify with the provider. Answer: D. Hold the medication and clarify with the provider. Rationale: incomplete allergy information requires the nurse to stop and clarify before administering any medication that may trigger an allergic reaction. Patient safety is the priority. Question 11. A nurse is administering a high-alert medication. Which action best reduces the risk of a medication error? A. Asking another nurse to confirm administration. B. Using a single check protocol. C. Reviewing the patient's history after administration. D. Skipping documentation to avoid delay. Answer: A. Asking another nurse to confirm administration. Rationale: high-alert medications require independent double checks to minimize error. This process enhances safety and accountability. Question 12. A patient refuses to take a prescribed psychiatric medication. What is the nurse's best initial action? A. Force the patient to take it. B. Document the refusal and notify the provider. C. Hide the medication in food. D. Leave the medication at the bedside. Answer: B. Document the refusal and notify the provider. Rationale: patients have the right to refuse medications. The nurse must document this and inform the provider to assess next steps ethically and legally. Question 13. A nurse is preparing to crush and administer a patient's extended-release tablet via feeding tube. What should the nurse do? A. Crush the tablet and mix with water. B. Consult the pharmacy about an alternative form. C. Administer the tablet whole through the tube. D. Dissolve in juice before administration. Answer: B. Consult the pharmacy about an alternative form. Rationale: extended-release tablets must not be crushed, as this alters the drug's delivery mechanism and may cause toxicity. An alternative should be used. Question 14. During a double check for chemotherapy administration, the nurse notices the dose is 10 times higher than normal. What is the first action? A. Administer as ordered. B. Call the pharmacy for clarification. C. Clarify the dose with the provider immediately. D. Ask a senior nurse if this is routine. Answer. C. Clarify the dose with the provider immediately. Rationale. Chemotherapy is high risk and requires exact dosing. Suspected overdose must be addressed directly with the provider to prevent patient harm. Question 15. A nurse notices an unsigned verbal order in the chart for morphine. What is the best action before administering? A. Call the provider to verify and sign the order. B. Give the medication based on the verbal note. C. Ask the unit clerk to sign the order. D. Delay administration until after the shift. Answer. A. Call the provider to verify and sign the order. Rationale. Verbal orders must be signed and verified before administration. Giving meds based on an unsigned order is unsafe and against policy. Question 16. A patient develops hives and shortness of breath after receiving IV antibiotics. What is the priority nursing intervention? A. Apply cool compresses. B. Stop the infusion and call the rapid response team. C. Administer oxygen at 2 liters per min. Elevate the head of the bed. Answer. B. Stop the infusion and call the rapid response team. Rationale. These are signs of anaphylaxis. The priority is to stop the trigger and activate emergency support. Question 17. The nurse notes that a patient is prescribed 2 medications with known adverse interactions. What is the nurse's next action? A. Contact the pharmacist to clarify. B. Administer both medications as ordered. C. Ask the patient if they've taken these before. D. Give one now and the other later. Answer. A. Contact the pharmacist to clarify. Rationale. Known drug interactions must be resolved before administration. The pharmacist can verify compatibility or suggest alternatives. Question 18. A nurse is administering an opioid and notices the patient is also prescribed a benzodiazepine. What is the nurse's best response? A. Administer both at the same time. B. Hold both until clarification is received. C. Administer the opioid and reassess. D. Call the provider to clarify safety of concurrent use. Answer. D. Call the provider to clarify safety of concurrent use. Rationale. Combining opioids and benzodiazepines increases risk for respiratory depression. Nurse must clarify and advocate for patient safety. Question 19. A patient is prescribed methotrexate for rheumatoid arthritis. What must the nurse verify before administration? A. Calcium level. B. White blood cell count. C. Sodium level. D. Glucose level. Answer. B. White blood cell count. Rationale. Methotrexate can cause bone marrow suppression. The nurse must verify WBC count to avoid administering immunosuppressants to a neutropenic patient. Question 20. A nurse is educating a patient about sublingual nitroglycerin use. Which statement by the patient requires further teaching? A. I will place it under my tongue and let it dissolve. B. If pain isn't relieved after 1 tablet, I'll take another in 5 minutes. C. I can chew the tablet if the pain is severe. D. I'll keep the tablets in their original container. Answer. C. I can chew the tablet if the pain is severe. Rationale. Sublingual tablets must never be chewed, as this alters absorption. This statement shows misunderstanding and requires correction. Question 21. A patient receiving vancomycin IV complains of flushing and itching of the upper body. What should the nurse do first? A. Stop the infusion immediately. B. Administer diphenhydramine. C. Slow the infusion rate. D. Notify the provider after infusion. Answer. C. Slow the infusion rate. Rationale. The symptoms suggest red man syndrome, a rate-related reaction to vancomycin. Slowing the rate is the first step unless severe symptoms occur. Stopping the infusion is only necessary if symptoms worsen. Question 22. A nurse is preparing to administer potassium chloride IV. Which action is most critical for patient safety? A. Dilute the medication in normal saline. B. Use a central line for all doses. C. Push the drug over 5 minutes. D. Administer undiluted via peripheral IV. Answer. A. Dilute the medication in normal saline. Rationale. Potassium chloride must never be given IV push or undiluted. It must be diluted and infused at a controlled rate to prevent cardiac arrest. Question 23. A patient with a new opioid prescription develops respiratory rate of 8 per min. What is the nurse's priority action? A. Raise the head of the bed. B. Administer naloxone. C. Apply oxygen via nasal cannula. D. Notify the provider. Answer. B. Administer naloxone. Rationale. Opioid overdose causes respiratory depression. Naloxone reverses this effect and is the priority to prevent respiratory failure. Question 24. A nurse prepares to administer a crushed extended release (ER) medication via PEG tube. What is the correct action? A. Crush and administer with 60 milliliters of water. B. Dissolve in juice and give quickly. C. Consult pharmacy for alternative form. D. Mix with applesauce for easier flow. Answer. C. Consult pharmacy for alternative form. Rationale. ER medications should never be crushed due to risk of overdose. The nurse must obtain a liquid or immediate release form. Question 25. A patient on warfarin reports using ginkgo biloba. What is the nurse's best response? A. That helps improve memory and is safe. B. Stop taking ginkgo. It increases bleeding risk. C. You can continue if the INR is normal. D. Take ginkgo only on alternate days. Answer. B. Stop taking ginkgo. It increases bleeding risk. Rationale. Ginkgo has antiplatelet properties and can increase bleeding with warfarin. It should be avoided. Question 26. Which action shows the nurse understands safe narcotic handling? A. Disposing of unused narcotic in trash. B. Returning unused narcotic to pharmacy bin. C. Flushing extra medication down the toilet. D. Sharing medication with another nurse for their patient. Answer. B. Returning unused narcotic to pharmacy bin. Rationale. Controlled substances must be disposed of following facility protocol, usually via lock bins, to prevent misuse or diversion. Question 27. A patient develops angioedema after the first dose of lisinopril. What is the nurse's priority? A. Assess airway and prepare for emergency. B. Notify the prescriber to change the drug. C. Apply cold compress to swollen lips. D. Administer diphenhydramine. Answer. A. Assess airway and prepare for emergency. Rationale. Angioedema is a life-threatening reaction. The airway must be assessed immediately as obstruction may occur rapidly. Question 28. Before administering insulin lispro, the nurse notes the patient has not eaten. What is the most appropriate action? A. Administer the insulin and monitor closely. B. Hold the dose and notify the provider. C. Document and proceed with next med. D. Administer a long-acting insulin instead. Answer. B. Hold the dose and notify the provider. Rationale. Rapid-acting insulin, like lispro, must be given only when food is available. Giving it without food risks hypoglycemia. Question 29. A nurse receives a verbal order for morphine. What is the correct response? A. Accept and administer immediately. B. Refuse verbal orders for narcotics. C. Repeat the order and document it. D. Write it and wait for written confirmation. Answer: C. Repeat the order and document it. Rationale: verbal orders should be repeated back, documented accurately, and used only in emergencies or urgent cases. Question 30. A pediatric patient is prescribed a dose higher than the recommended limit for acetaminophen. What should the nurse do? A. Administer and monitor liver enzymes. B. Give half the dose and inform provider later. C. Clarify the order with the prescriber. D. Document and administer as ordered. Answer: C. Clarify the order with the prescriber. Rationale: medication safety in pediatrics is critical. Doses must be verified if they exceed safe limits to prevent hepatotoxicity. Question 31. Which instruction is essential for a patient newly prescribed warfarin? A. Increase leafy greens to improve vitamin K. B. Use a soft toothbrush and electric razor. C. Avoid dairy products. D. Double dose if a dose is missed. Answer: B. Use a soft toothbrush and electric razor. Rationale: bleeding precautions are critical with warfarin. Patients must avoid trauma and monitor for signs of bleeding. Question 32. A nurse is administering IV phenytoin. Which finding indicates the medication was administered too quickly? A. Facial flushing and hypotension. B. Tremors and muscle twitching. C. Bradycardia and decreased urine output. D. Shortness of breath and cyanosis. Answer: A. Facial flushing and hypotension. Rationale: rapid IV phenytoin can cause cardiovascular collapse. Infuse slowly and monitor closely. Question 33. A nurse notices an unfamiliar medication on the march. What is the safest action? A. Administer the dose and document. B. Ask a colleague and give it if they confirm. C. Look up the drug and clarify if unclear. D. Skip the dose and wait for next round. Answer: C. Look up the drug and clarify if unclear. Rationale: nurses are accountable for safe medication administration. When unsure, they must verify the drug before giving. Question 34. Which action demonstrates safe medication reconciliation during discharge? A. Give the patient a list without explanation. B. Compare the discharge list with home meds. C. Ask the pharmacy to handle the process. D. Assume all previous meds will be continued. Answer: B. Compare the discharge list with home meds. Rationale: reconciliation prevents duplication, omissions, and interactions. It's vital during transitions of care. Question 35. A nurse is administering IV potassium chloride and notes burning at the site. What should the nurse do first? A. Stop the infusion immediately. B. Apply a warm compress. C. Increase the IV rate. D. Administer lidocaine through the site. Answer: A. Stop the infusion immediately. Rationale: burning suggests extravasation or vein irritation. Stopping the infusion prevents tissue damage. Question 36. A patient on digoxin has nausea, blurred vision, and a heart rate of 48 BPM. What should the nurse do? A. Hold the dose and notify the provider. B. Give the dose and monitor closely. C. Increase fluids to flush the drug. D. Administer antiemetic first. Answer: A. Hold the dose and notify the provider. Rationale: these are classic signs of digoxin toxicity. Withholding the drug and alerting the provider is essential. Question 37. A nurse receives an order for insulin glargine and regular insulin at the same time. What is the correct administration method? A. Mix both in one syringe and inject. B. Give glargine first, then regular insulin. C. Use 2 separate syringes and sites. D. Delay one dose by 30 minutes. Answer: C. Use 2 separate syringes and sites. Rationale: long-acting insulin glargine should never be mixed with other insulins. Use separate syringes. Question 38. Which statement by the nurse shows understanding of look-alike/sound-alike drugs? A. They should be color-coded by the nurse. B. These drugs require special labeling and alerts. C. They are only a concern in outpatient care. D. Only pharmacists need to worry about them. Answer: B. These drugs require special labeling and alerts. Rationale: look-alike/sound-alike medications are a major source of error. Special precautions are essential. Question 39. A nurse is preparing to administer a high-alert medication. What should the nurse do before proceeding? A. Administer and monitor vital signs. B. Double-check with another licensed nurse. C. Ask the provider for reassessment. D. Inform the patient of expected side effects. Answer: B. Double-check with another licensed nurse. Rationale: high-alert medications require independent verification to reduce error risk. Question 40. A patient is on multiple medications and develops confusion. What is the nurse's first action? A. Assess for polypharmacy and recent changes. B. Notify the provider for further orders. C. Call the pharmacist immediately. D. Document findings and monitor. Answer: A. Assess for polypharmacy and recent changes. Rationale: confusion in older adults often relates to adverse drug reactions. Assessing the med list helps identify the cause. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.